few concepts of brain which need to be understood by scientists like you all is that what we thought when we were undergraduate students doing MBBS, it looked as if all the neurons which were formed at birth almost remained the same. There was no change. And the brain was a static organization. That's what we thought. But soon one realized that there are many changes which occurs, and you use the word of neuronal plasticity. What do we mean by that? That means new connections can be formed, programming can be changed. I'll just give you an example. In the brain, our body is represented in an inverted way. It's called the homunculus. Like the hand area will be somewhere here, the speech, and the leg will be there. Now, that's well represented. And then there are experiments to show that if you were to strap one or two fingers, with something and not make it work, the part of the brain which is controlling this limb, these two fingers, will become smaller in size because it's not being stimulated. The other example, the opposite example is, if you go on giving an electrical current to the same index finger, the area of the index finger increases. Okay? So what we thought was stationary pictures now is a dynamic change. Depends upon the use or misuse. I think all of you have read in the newspapers, use the brain or lose it. So what we are talking about is stimulation. These are the fundamental concepts of brain function. Stimulation versus dormancy. Now, in this, I'm just taking on a few of the issues which you have mentioned. So neuronal plasticity has to be understood in its fullest form because whatever devices you people make has to be an ever-changing thing. It cannot be a static connection. Now, I saw the example which Professor Prabhat Ranjan showed us in our Delhi neurology meeting, and it was very fascinating that a person who could not communicate for 13 years could make some signals. Now, as a neurologist, we see a large number of diseases. Just to name a few, like a stroke, which suddenly occurs, paralysis of one side of the body, and if the left half of the brain is involved, even the speech is gone. The person understands, one part of we call as Broca's area, understands what is spoken, but cannot reply because the word formation is not there. The another way of speech impairment, if it's a little part, posterior part of the brain, whatever you ask the person, they don't understand. Now, this is a great disability. How does that person communicate? The person who has what we call expressive aphasia. Aphasia means loss of speech. Expressive is you cannot communicate. Other one is called receptive. You can't even understand. So if you are trying to help, these patients are numerous in this country, following strokes, following head injuries. India has the largest number of road traffic accidents. Please do not forget that. They have brain injuries, limb injuries, all parts of the body are injured. How are we going to rehabilitate them? So the concept of neurorehabilitation has to come from your side. I'm just trying to give some examples. People are aware of that. Then Stephen Hawking, you mentioned. Stephen Hawking has got a disease called motor neuron disease or amyotrophic lateral sclerosis. That is my area of specialty. Last 40 years I've been working on these patients. It's a very sad disease to have. It affects the speech, the swallowing, the movements of the hands, the legs, and finally the breathing. The person usually dies between 3 to 5 years. They can't eat, they can't swallow, they can't breathe. So we give all artificial methods of sustenance. Now, Stephen Hawking could be kept alive because of your technologies. He cannot breathe on his own, so there is something which helps him, ventilation. He cannot speak, so that he does through communication through some little cheek muscle which activates. That's how, because he's a top scientist, all the great technologists went and helped him. But there are so many people in this country. I've done a population-based study. 4 per 100,000 may have ALS, and I see them almost every day. How do we tackle these patients? How does the family get help for these? Parkinson's disease, people fall down, get injured, so on. I mean, there are numerous examples. If I go on, I'll give a lecture on clinical neurology and diseases. You talked about mental retardation, how children cannot cope up with their education, with their games, the play, and so on. There are numerous ways of helping people. I'm sure somebody is going to ask about stem cells. Every patient of mine asks, can we not put stem cells in Parkinson's disease or ALS? Well, these are experimental studies being done in the animals, but so far it has not come to the clinical arena. Now, the brain is a very complex thing. We are not just talking about memory. We are talking about past experiences. Just imagine if my brain is transplanted into Prabhat Ranjan's, he carries all my childhood memories, not his. So how does he function? So while you can do heart transplant, liver transplant, kidney transplant, brain transplant is possibly, out of question. But what can be done is a tissue can be replaced. So brain is not just memory, cognition, consciousness, but it is an emotional concept which is built up from your very childhood. So be very careful when you computer scientists come in and try to help. There are a lot of safeguards which have to be built in. Many of the things which you said sounded like scientific fiction, but I'm sure they will reach the reality one day. I think I won't talk more than this. If any questions, any specific, I can address them.